Everybody, Diana here. So as promised, I'm going to come on and show you a little bit about the fecal occult blood test collection process. This is a screening tool that is recommended yearly. Okay, this is not to take the place of a colonoscopy, but this is a good screener that we use. I've got a few points here. It's to tell you about. It's non-invasive. It does not harm you. It does not hurt you. The word occult means not detectable to the untrained eye, or rather not visible to the eye. So that's what occult stands for. So what it's trying to detect is traces of blood that you would not normally see. So when you go to the doctor or your nurse practitioner or any other, say your midwife, or you go to a health department and they ask you if you're having blood in your stool, you may not see the blood. It may be undetectable to the eye. So this is why it's important to do a fecal occult blood test, okay? Remember, you can have bleeding from any number of reasons, or for any number of reasons. Say you have hemorrhoids. Say you have diverticulitis. Say that you have ulcers. Say that you've taken anti-inflammatories and you're having some irritability in your stomach. Say that you may have colitis, polyps. So just because you get a positive test is not reason to panic, but it is reason to investigate further or let your primary care physician know so they can take the next steps, okay? Again, it's used for screenings. It's recommended to be started at a minimum the age of 50 if you're having weight loss, if you're having appetite loss, if you're having change in bowel habits, changing bowel, say that your bowel movements have a different shape to them, say they're ribbon-like or thin. That can be something you need to report to your primary care provider, okay? Basically, you collect a stool sample, you take it to your primary care doctor's office, or you take it, or you mail it to your primary care provider's office, okay? You can also get samples at drugstores or pharmacies, okay? So how to prepare? It's very important that within 7 days of this test that you do not consume vitamin C. 250 milligrams of vitamin C can interact with the chemical used to detect the blood in your stool. So it's very important not to consume vitamin C. So if you're eating a lot of fruit, you may want to lay off. If you're doing a vitamin C supplement, you may want to stop that until your test is completed, okay? Another thing, if you are in the habit of taking anti-inflammatories on a daily basis, say you take ibuprofen, naproxen, Mobic, you're going to want to stop that. Now, before you stop an aspirin, you need to talk with your cardiologist if you're on it for reasons of, say you have atrial fib, atrial flutter. You need to talk with your doctor. I'm not telling you to stop your aspirin before you do a fecal occult blood test. Those are questions you need to ask, okay? And then also, it's very important to avoid red meat, lamb, beef, pork within 3 days, because what can happen is this occult blood test can detect trace amounts of blood that was in the meat that you consumed. That's very important within 3 days, okay? So that's pretty much the prep. There are no risks. Again, if it detects blood, that does not mean that it is a cancerous polyp. It could be one of the other reasons I talked about. So let's go in the restroom here, and I'm going to show you how the kit works and how simple it is, okay? 1 second. Come on in. All right. So what I have here is I have a test kit. Your test kit will include instructions for collection, which is very simple to follow. It will include a collection, a container or a specimen container. This will be labeled with your name and your birthday and identifiers for you. This is the purple cap. You will use this to stick into your specimen, your stool specimen. You're not going to want to dig into the specimen. That is not what we want. We want an in and out 6 times in the specimen, okay? You also have the specimen bag here. You have a mailer to mail it back to the office. And this is a little note that says, hey, if you collect this at home, you need to have it returned to the doctor's office or the provider's office within 48 hours. Okay, so these different kits will look a little bit different, but they all serve the same premise or have the same end result, okay? So this is our biodegradable collection paper, okay? It has adhesive tabs here on the side So we're going to come in, and I'm going to go ahead and take our adhesive strips off. And we're going to drape it just inside the toilet, underneath the toilet lid. You can see here. So what you're trying to do here is just to provide a surface to be able to collect the stool sample, okay? And we also provide another one, and you would want to do it likewise here, okay? For sake of time, I'm not going to do the other one. Once you have had a bowel movement and it is there, you will again take the stick and you basically do just a sticking method, okay? You will stick here 6 times into the material or into your fecal stool sample. You will replace the cap, seal it here, put it in the envelope, bring it to us, bring it to your primary care. Again, try not to do a scooping method. That will result in an error and you'll have to recollect. So it's very important that you do this once a year. Make sure that your primary care is offering this to you, because it's something that, you know, sometimes you come into doctor's offices and the hustle and bustle of the office, the wait, say you're complaining of back pain or say you're having headaches. This may get missed. This is a very important screener that you need to be taking part in once a year. Diana Miller, hope you enjoyed the video. I hope it helped. Bye.